It is 12 o'clock and we're going to get started. Welcome, everybody. I'm Chris Taravasi, and I'll be conducting this program for today. I appreciate your time and attention while we go over this very important information about OSHA and safety. And without further ado, let's continue the program. When the program is done, please be sure to sign the attestation. The form has been sent to the department heads and will be available for you to sign afterwards. So the first thing we want to talk about is, Chris, why another mandatory program? Well, truth be told, we should have been doing this for a while. It's taken us a while to get it put together. But really, what this is all about, this OSHA review, is just to basically to have MHA assist the offices with the obligation we have. And so we put this together, this comprehensive review of all things OSHA. On top of what MHA is doing today, each of the office still needs to develop its own internal program because every office is different in terms of a layout and function. And even though you're similar, there are differences. So each office will still have responsibility to develop its own program. So what I'm asking you to do more than anything is please step up, volunteer, go to your supervisors and offer to help them because this is a program that impacts all of us. Okay, so what's next? There's the agenda for today's program. By the end of today, the next half hour or so, we will have touched on each of these topics to some degree. It's by no means comprehensive. There is an official manual that will be placed on the J drive, as well as this presentation, which will go into more detail. But we at least want to highlight each of these as we go forward here. So everything OSHA. OSHA is all about maintaining a safe work environment, and it requires a continuous commitment between MHA, the offices, and you. We need to be on guard and be aware of potential hazards. We need to be proactive whenever we possibly can. We need to continue to look at our policies and procedures. We need to communicate, and we need to make suggestions. Each of us need to make suggestions to improve our safety. You know, more so than that, we want to be an organization. We want MHA. We want the divisions to be known as a company that cares about not only patient service, but that we are compliant and we want to provide a safe environment for our staff and patients. And yes, that means we have to accommodate this, I say, seamless, endless array of federal and state regulations, and it's so true. Because the federal regulations and the state regulations are separate rules. Some of them are the same, some of them are different, and we're obliged to pay attention to both of them. Which means that some changes, some immediate over time. There's going to be changes. Each division, as it reviews its own program, will need to make its own decisions as far as policies and procedures. And so you should expect some changes. Some will happen right away, and some will take time. So let's talk about bloodborne pathogens and exposure. We need to identify those procedures that each office does that's most likely it involves an exposure to blood or other bodily secretions. An exposure incident is a specific eye, mouth, or mucous membrane, non-intact skin, or with blood or other potentially infectious materials. You'll hear me say OPIN at a later point, but basically that's everything that's not blood that could be potentially infectious. And we need to determine which positions within the company have general versus incidental exposure. What's the difference? Incidental exposure is indirect and does not typically pose a significant health hazard, and as opposed to general exposure or direct exposure, and that implies more of an opportunity to a direct exposure. So, for example, the clinical positions are all considered to be general exposure, and ergo they have different sets of responsibilities when it comes to OSHA and protection. If you want to know the exact list, I did put references in here, so you're welcome to look up where I got this information from. So what's next? Training. For those with potential direct exposure, you need to work with your supervisor to determine how to accomplish your task safely. We need to understand the hazards and what you could be exposed to for the things that you're expected to do. We need to use PPE, personal protective equipment, every time. If you're not sure how to use it, ask. Please communicate with your supervisor to reduce your risk. And what happens? Oh my gosh, we had an incident reports. So what happens if we experience a safety incident? Why report it? To whom to report it? What to report? And I don't say more importantly, but can this exposure be used as a learning experience to prevent another mishap? So with regards to the documents that we use and the forms, the managers will also have the official MHA book of forms. And one of the forms that you'll see, hopefully not because you need it, is the actual employee incident form. So if there's ever an incident, job-related injury or illness, regardless of the extent, we need to complete an incident form within 24 hours. It's kept at MHA offices in confidence. And that is sort of the ground zero for start of any process when it comes to an injury on the job. And a note about housekeeping. I want to point out that it's our responsibility to clean and disinfect workstations. It's not the cleaner's responsibility. We shouldn't trust, as good as they are, we still need to take ownership of the space around our workstations, phones, especially any equipment that comes in contact with our patients. Cleaners should never touch anything electronic or clinical equipment or computers or analyzers. It's really our responsibility to clean around our workstations. It's not the cleaning responsibility to pick up the trash that you missed the garbage can with. We should do our part to keep the office tidy and clean. And yes, we will keep an eye on cleaners to make sure they're doing their jobs, but we just can't rely on them to take care of every single thing that's in the office. Again, if you need cleaning materials, reach out to your supervisor. And if you are using those cleaning materials, especially anything bleach related or cleaners, be sure to use your PPE. Let's talk about universal precautions. It's a very simple concept. We should just expect that any blood or bodily fluid coming from every person is considered potentially infectious. Gloves are worn when touching blood or body fluids, mucous membranes. Basically, any contact with the patient should be done with gloves on. Gloves should be worn when handling items on surfaces soiled with blood or body fluids, or basically anything that has potentially infectious material on it. Gloves are single use per patient. If you have an open wound, be sure to cover it. More information about universal precautions. We should wash our hands, of course, after each patient contact, mask and protective gloves, things that are there to protect us should be used as appropriate. Sharps especially, you need to be very careful with those, avoid contamination. They're disposed of properly in puncture-resistant cans, and those should be available in all areas where injections and so on are being done. And again, review our policy and procedures for other precautionary procedures. And of course, beverages and foodstuffs should not be kept in the same fridge as patient specimens or hazardous materials. That's a bad thing. You shouldn't do that. Okay, workplace control. So what are those? These are the various things that MHA and the offices have purchased or acquired in order to protect us. For example, wearing gloves, washing your hands, in-use labeling, things that are labeling and such to protect us. And of course, there's the infamous recapping a needle, which should never be done. Whether it's a clean or dirty needle, there really should be no reason why you should recap a needle, in my personal white-collar opinion. However, I will defer to the supervisors, and please be sure if you feel the need to recap a needle, they need to know why, because that is one of the biggest reasons why there are needle stick incidents. Okay. Oh, go. No, it's not going. There it is. Okay. So workplace controls continued. We have specific items of protection, personal performance protection, sharp containers, medical waste containers, and our first attempt at a multimedia extravaganza, Dawn. Here we go. Let's see if this actually works.
Yay.
Okay, guys, so now I'm going to show you how to properly take your gloves off. So the way we want to do this is I'm going to use one hand to grab the inside of the glove, to grab the glove that's on my palm of my hand. So I'm going to grab here. By not going up here, I'm not going to be taking anything dirty on this glove and getting it onto my bare skin. So I want to go down here to this area, pull the glove straight down. Okay, so now my skin has not touched any part of the glove. I bundle this up into the other hand, and then I slip my fingers under the glove this way and come down and over and right into the trash can there. So, and everything was bundled into one ball turned inside out. So much safer way to take your gloves off.
Yay, that's pretty cool. I'm so proud of myself. It's a first. Okay. Sharp containers, very important. Of course, a sharp container is a impenetrable container, plastic container, in which needles are placed carefully. We have to be sure not to overfill our sharp containers. I know some of this is common sense, but oh my gosh, it's not unusual for someone to overfill a sharp container, and next thing you know, a needle pops out the other side. So please be sure to pay attention to the fill line on your sharp containers, and when they're filled, seal them immediately and put them into the red bag for disposal. Okay, let's talk about multi-use solutions, cleaning solutions, medicine, injectables, whatever is a multi-use should have an in-use date on the package. And this does not include household type stuff, but anything that has multi-use, it should have an in-use date on it and an expiration date on it. The person using that substance should check expiration. And the person who put it into use should mark it as in use on a certain date. Red medical waste containers, if you open it, make sure you close it, and please don't overfill it. More on the PPE. It's just used to prevent exposure to potentially infectious materials. We're responsible for choosing the appropriate. What are the hazards based, and we use that based on whether or not it is a procedure that it could, oh my gosh, and take two, action. It's a procedure that could cause a hazard if exposed. We need to assess that, decide what PPE is appropriate, and of course, training is very important. If you're not sure, please ask. I know hand washing, Chris, really? Yes. We're going to talk about hand washing. Why? Because believe it or not, it's mentioned in the rules, and of course we wet our hands first. Amount of product, the soap is a function of how dirty your hands are, I suppose. Rub your hands together 15 seconds, rinse them thoroughly. Try not to use too hot of water because you could actually damage your skin. And actually, there is a policy in the CDC about how to wash your hands. I really didn't make this up. It's really a law, not a law. It's a guideline. Okay, cleaning, decontamination, disposal of waste. Please wash and wipe your counters daily. If there is a contamination, use the appropriate cleaning and disinfecting agent. Equipment, be sure patient to patient, if it comes in patient contact, that it's cleaned in between each patient. And again, only use medical waste. Only medical waste can be placed in red bags. Let's talk for a minute about what the definition of contamination is. Contamination means presence or reasonable anticipated presence of blood or other OPM on an item or service. Very simple. Contaminated laundry means laundry, your gowns and such that have been soiled, or your lab coats if you do wear them with blood or OPM. Soil laundry is different in as much as it has not been exposed or contaminated with blood or OPM. And as far as how do you handle it, if you have soiled laundry, it can still be washed at home or professionally. If it's slightly contaminated laundry, having a few drops of blood in here, it can still be washed at home or professionally. But anything that's truly contaminated, it should be placed in red bags and disposed of as medical waste. And in many cases, I know some of you use disposable gowns. That's fine. Same rule though, if it's not been contaminated, you can dispose of it in regular waste. But if it has contamination, then clearly it has to go into a red bag. So let's just be clear: what goes into medical waste, sharp containers that have been closed, other materials that contain blood or OPIM, other items soaked or dripping with blood or OPIM. What does not go into medical waste? Medication or pharmaceuticals, empty vials. A pharmaceutical should not go in medical waste. Loose sharps, of course not, should not go in medical waste. Any hazardous or chemical waste, garbage or recyclable stuff, fixatives and preservatives should never go into the red bags. And just keep in mind, those red bags are disposed of differently than things that are hazardous or garbage or recyclable. There's a cost associated with that as well. So here's your test. Yes, Waldo is there watching. Is this medical waste or not? Audience? Is this considered medical waste? Yes or no?
Yes.
Think so? Technically, no, because it's just a drop.
Oh.
How about that?
Well.
There you go.
And the sharks have to go to the shark.
Right. How about a little Band-Aid with a little blood on it? No. How about an eyeball for white balls? It could be, and last but not least, yes, this is a reference from the 1983 Young Frankenstein movie with Abby Normal. Remember Abby Normal? Okay. All right, that's it for comic relief. Moving forward, office hazard communication program. Each office needs to identify an office safety coordinator. This person is going to be responsible for some very important functions. One, that's going to be facilitator for training programs, be it on the nursing side, front desk side, wherever within the office. This person should carry the policies and procedures on how to train individuals. They are also the arbiter to as far as labeling items in the office, other forms of warning. They're the folks that will be responsible for collecting material safety data sheets in their offices. They will keep the master list of hazardous chemicals. And of course, we need you to assist them to be sure that they have that information as well, or if there are questions. So as far as hazards go, some of these hazards we'll never see. The ones in the bottom, of course, more magnetic, more radiology oriented. The others on the right-hand side are the various types of hazards that are out there. These are all universal signs. And of course, the one that's most relevant for our practice will be the biohazard sign. Okay, we're closing in on it, folks. 16 minutes. We're doing pretty good.
Okay.
Are they paying attention, you think?
Yeah.
Oh, good.
I checked.
Okay, good. Thanks, Dawn. Let's talk about ergonomics. Again, one of these things we take for granted, whether we're at home or at work, is how we relate to our workstations. And some of us are more casual about it. Some of us are more intense about it. And when it comes to ergonomics, it's one of those things that you don't pay attention to it till it bites you, until it gets you because of the repetitive nature of how we relate to our workstations. And I think it's one of those things that's best told with pictures. What you're looking at here are some pretty obvious examples of how you should not relate to your workstation. In the upper left-hand corner, we have this young lady who's bent over. You can see her spine is not upright. She's bent over. She's leaning into her workstation. The gentleman on the right also, you can just tell his way he's looking into his screen is not healthy. In the lower left-hand corner, the bad, you're seeing how this person can impinge her nerve and her wrist. And lastly, for some reason, people like to sit on their feet. I don't get it, but they do. And if you catch somebody sitting on your feet, oh, no, I shouldn't tell them to push them over. That's not good. No, don't push them over. Just say, please don't sit on your foot. Okay, that's probably the best way to handle that. Yeah, see. Okay, now good ergonomics. Now, if you look at the nice on the side, we like that vertical, straight, 90-degree angle between your spine and your lap. We like on your arms that 90-degree angle between your shoulder, your elbow, fully supported, your wrist fully supported, your knees bent, hopefully your feet touch the ground. And what I'm going to ask you to do is, as you look at your workstation and you feel that it's not ergonomically correct, please let your supervisor know. Why do I tell them that? I say that because it's far less expensive for the company to help you get the right wrist support or the right foot support or the right back support than it would be to pay the claim someday because you're ergonomically disadvantaged. So please pay attention to your ergonomics. And on the right-hand side, you'll see the gentleman sitting on the first slide improperly, the next slide correctly. And of course, even standing makes a big difference. And of course, lower right-hand corner, up the right and wrong way again to address your keyboard. Lifting. For those of us with bad backs, a lot of it's because in our early days we didn't pay attention to our lifting style. You want to keep your spine as straight as possible when you lift. Bending over at your hip is one of the worst things you can do because you're bending your spine. So please focus on lifting properly. I don't care if it's a hanger on the floor or if it's a 50-pound box. Your technique should be the same. Okay, guess what? It's 19 minutes in. We're doing great. Here are your action items, folks. We need you to sign the attestation station. We need you to review the policy and procedure document once it's published in the J Drive. We need you to support your safety coordinator by being his or her eyes and ears for safety issues. When you get back to the office, I'd like each of you to find your fire extinguishers. Please know, even if you don't know how to use them or want to know how to use them, you should know where they are. Frankly, if there's a fire in your office, your responsibility is to get out of the office. Let your supervisor take care of making sure everybody's out, but get out of the office. We need you to actively participate when your coordinator says it's time for training or retraining. And please, if you're not sure, ask. It's the only way we're going to be sure that you are protected. Guess what? I'm done. If you have any questions, I can't really do anything here, but feel free to send me an email or give it to your supervisor, and I'd be happy to do my best to address the things that I've left out. I think that concludes the procedure of the process for today.
Yay.
Yay. Okay. I appreciate your time, and I hope you have a great day. And